Good evening, ladies and gentlemen. This is Antonio Colon with your scientific podcast. Today on Scientific Talk, you'll be learning on the endocrine disorder menopause. What is menopause? Each woman is born with a certain amount of eggs, which are kept in their ovaries. The hormones estrogen and progesterone are produced in the ovaries as well. Menopause is when the ovaries stop releasing an egg every month and menstrual stops. Some women can go through menopause early, and this event can be caused by damage to the ovaries, like you might see from chemotherapy or a surgical procedure like a hysterectomy. There are 3 stages of natural menopause, and that is perimenopause, menopause, and postmenopause. The perimenopause phase usually starts before actual menopause and is the levels of estrogen and progesterone beginning to decline. Many women go through the traditional menopause symptoms in the last 1 to 2 years of this stage because the hormone levels drop quickly. Menopause is marked by the woman going a year without her menstrual cycle. This stage, where the ovaries stop releasing eggs and the estrogen levels have dropped dramatically. The postmenopause stage is the stage in the years after a woman has completed the menopause stage. During this stage, any lingering symptoms of menopause disappear, but any health risks that are caused by low estrogen levels rise. What can cause premature menopause? Premature menopause can be caused by autoimmune disorders, genetics, or some medical procedures. First one, menopause that has been artificially induced. When the ovaries are surgically removed, induced menopause develops. They can be removed because a woman is at a high risk of developing uterine cancer. Induced menopause can also be triggered by ovary damage, by chemotherapy, or radiation. The second one, early ovarian failure. This occurs when the ovaries stop releasing eggs early. The causes and reasons for this condition are largely unknown. This can cause an imbalance in estrogen or progesterone. These levels in the body can trigger menopause symptoms in a woman in her 30s. What mental change symptoms of menopause consist of? The first one is a decreased libido. It reduces your estrogen levels. A disinterest in sex is common, and vaginal dryness, also a delayed clitoral reaction time. The second one, depression or mood swings. Because of the hormone changes a woman goes through, many women report that they go from extreme highs to extreme lows and quickly and experience more feelings of irritability and depression during this time. The third one, insomnia. This can be caused by menopause and affect your ability to fall and remain asleep. It may lead you to wake up earlier than expected and or making it difficult to fall back asleep fast. What are the physical changes in menopause? Physical changes include 1. The menstrual cycle, where the period is becoming irregular. Heavier or lighter cycles than normal, and may also spot between cycles. A woman's cycle may also be shorter or go for longer spans of time. If you find yourself missing a period or two, that can indicate that you're becoming premenopause. It is also a good idea to consult your doctor if you start spotting after less than a year to rule out any significant medical concerns, such as cancer. The second one, the most prevalent menopause symptom reported by women is hot flashes. The intensity of a hot flash can range from mild to severe. They have been known to be strong enough to wake a woman from their sleep. Also, the National Institute on Aging reports that a hot typical flash can last from 30 seconds up to 10 minutes an episode. Hot flashes will last 1 to 2 years after menopause, although they will gradually fade and eventually end. If they don't, they can recommend treatment options. The third one is skin loss and hair loss changes. Loss of skin becomes drier and thinner due to the loss of collagen and fatty tissues. This loss also affects the elasticity and lubrication levels around the vaginal area. Rapid hair loss may be exacerbated by low estrogen levels. You may also notice that your hair is brittle and dry to the touch. 4. Urinary incontinence is a frequent menopause symptom in which the tissues in the vaginal and urethra lose their flexibility, the lining thins, and the pelvic muscles weaken. You may also feel compelled to use the bathroom, and it may burn when you do so. The fifth one is vaginal dryness or pain during intercourse due to a decrease in estrogen and progesterone hormone production. The thin layer of moisture that protects the vaginal walls can be compromised. The burning, itching, the stinging are some of the other sensations that come with a decrease in moisture. What can help fight the symptoms? There are several essential oils that can help fight signs and symptoms of menopause. Today, I will talk about the top 7 essential oils and why they help. 1. Central essential oils. This oil has many health benefits and has been shown to be very useful in helping with menopause symptoms. A variety of studies shown over the years that shown that this essential oil often experience an increased desire for sexual intimacy, decreased menopause symptoms, lower blood pressure, and improved estrogen concentrations. The second one, basil essential oils have been shown to reduce the effects of hot flashes, help increase your estrogen levels, and calm your overall mood. The third one, lavender essential oil. This oil is used to help balance hormones. It is also marketed as a natural antidepressant, also an excellent agent if you're experiencing insomnia. The fourth oil is geranium essential oil. This oil helps to manage hormone changes and fight dry skin. This promotes stress, anxiety, and depression relief. The fifth one is the clary sage oil. And this oil is to reduce the risk of developing osteoporosis. The sixth oil. This oil is called the peppermint oil. This oil that seems to be mentioned more than most. This oil can help reduce the cramping feeling that comes with menopause, and also a natural hot flash aid. And the last oil, this is the Vitex Agnus Castus oil. This is one of the lesser known oils available. It comes from a shrub that is native to Central Asia and is used for controlled bleeding, helping to fix infertility, balance hormones, and alleviating menopause cramps. Ladies and gentlemen, this is all I have for the endocrine disorder menopause. Thank you for tuning into my podcast, Scientific Talk, and today's topic, the endocrine disorder menopause. Thank you once again, and good night.